Hello everyone, happy evening, a very good evening. Am I audible and visible? Yeah. So I hope you can see me and hear me, everyone. And a happy evening, everyone. A very good evening. I hope and I believe all of you are doing well. You know, had gotten very tired post making that reel. Just kidding. So got late. Yes. बहुत मेहनत लगी रील बनाने में, बट एक्चुअली नहीं, सबने बहुत जल्दी सीख लिया. अभी चोर का और कुछ कुछ लेना बाकी है थोड़ा सा, और शायद वो कायरा के साथ लेके जाएगा. Right, so stay tuned for that as well. uh, okay, so everybody here is ready for the fast 5 clinical MCQs. I hope you have attempted the quiz as well, and whenever you have Dr. Nikita's live class, utilize those 15 minutes before the class basically for revision. So I give you that deliberate 15 minutes for revision, but क्योंकि मुझे पता है कि तुम खुद 15 minutes निकाल नहीं पाओगे schedule में. So Dr. Nikita is giving you that 15 minutes slot for quick revision of whatever you have read yesterday or in the entire day to consolidate that. Okay, so that's your blessing in disguise. So make the best use of that. Okay? Yeah. I mean, we had a lot of fun making that. I mean, बहुत मजा आया. How I convince everyone? Actually, मुझे convince करना ही नहीं पड़ा. I mean, very surprisingly, मेरा primary idea नहीं था. So तो लगता है कि मेरा आइडिया होगा, बट वो प्राइमरी आइडिया मेरा नहीं था. So everybody was very excited to get out of the comfort zone, to come out of the shells and experiment something new. And yeah, I'm sure all of us had a great time doing that. All right, so tell me, how did you score in the today's Fast 5? Yes? कैसा स्कोर रहा आज के Fast 5 में, everybody? So for those who are not on the Medsynapse app yet, where you can attempt these Fast 5 quizzes for free, you can do it post class also, the previous ones as well. And this is basically, you can scan this QR code and get to the Medsynapse app and keep revising. The graphs were not visible on the app, is it? मुझे तो दिखा था. When I tried to check it, I was able to see the graph. Probably, I don't know. Okay, I'll keep a note of that, and next time I'll look into it and try to improvise that. Yeah, but Rahul says 5 on 5 and Akshat Vishwas says 4 on 5. That's great. Okay. So let's start with the discussion of the questions today. So this is a question which is asking basically about which of the following changes in enzyme activities and regulatory molecular concentrations in liver is most likely in this patient. In this patient matlab kaun sa patient? A man who is lost in the desert for 1 week with ample supply of water. ये उल्टा हो गया, desert में पानी बहुत है लेकिन खाना नहीं है, but there's no food. हमारे क्वेश्चन के लिए कुछ भी हो सकता है, ठीक है. So basically what is this telling about is the fasting state. The question is about the fasting state. What happens to fructose 2,6-bisphosphate, glucose 6-phosphatase, PEP, phosphinol or pyruvate carboxykinase and pyruvate kinase. So all we need to know here is our concept of fed and fasting, which we have discussed in biochemistry short as well. Fed versus fasting. What is the hormone of the fed state? After meals, what levels increase? It is insulin, right? So I can say that insulin is anabolic or catabolic. Remember that insulin is anabolic, it increases in the fed state. So basically it will increase the synthesis of everything in the body. It will build up the body stores, except what synthesis it will not increase? It will not increase the glucose synthesis, that is gluconeogenesis. Right, these are the crux, the points that you should know कि gluconeogenesis नहीं बढ़ाएगा और दूसरा क्या नहीं बढ़ाएगा? जो फास्टिंग स्टेट में जेनेसिस आता है, what increases in the fasting state is ketogenesis, right? The ketone bodies increase in the fasting state. So except gluconeogenesis and ketogenesis, insulin increases all the other synthesis, right? It increases the protein synthesis, the fatty acid synthesis, the glycogen synthesis. It tends to increase the rest of them. Okay? Now, talking about the cycles, what cycle will be active when? Glycolysis is active in fed state or fasting state. Glycolysis. Remember, in the fed state, it is all the genesis except ketogenesis, gluconeogenesis, and the lysis which is active here is glycolysis. Glycolysis basically is glucose utilization, the glucose that we are eating. If it's a fasting state, we are not eating glucose, so glycolysis will decrease in the fasting state. It will be more in the fed state. Glycolysis will be more. Glycogenesis will be more. Gluconeogenesis will decrease. That is what this question is based on. Okay. So basically this question is based on what happens to glycolysis, what happens to gluconeogenesis, and what happens to glycogenesis in the fed state and the fasting state. So glycolysis is a cycle of the fed state, gluconeogenesis, new glucose synthesized in body in the fasting state, and glycogenesis again is fed state. That's what you need to know here. Okay. So now look at these various compounds. पहले मैं enzymes पे आती हूँ. Glucose 6 phosphatase. I hope that rings the bell in your brains that glucose 6 phosphatase जब deficient होता है तो कौन सी condition होती है? What condition do we get when glucose 6 phosphatase is decreased? What glucose 6 phosphatase deficiency? What does it lead to? Which condition? Right, that's the last step of glycogenolysis. That's also the step in gluconeogenesis. There's severe hypoglycemia, right? The Von-Gerke's disease. Absolutely right. This is deficient in Von-Gerke's disease, glycogen storage disorder type 1. So glucose 6 phosphatase is the enzyme of glycogenolysis and also gluconeogenesis, right? So that basically means this is going to be increased in fasting state. This person is a fasting person. So obviously इसके levels बढ़ेंगे तो कौन सा option हम rule out करते हैं? It is not decreased. Option C is ruled out. Okay, option C is ruled out. Coming to the rest of them, PEP carboxykinase. This is an enzyme of which cycle? PEP carboxykinase. This is for gluconeogenesis. Gluconeogenesis, the first committed step there, converting oxaloacetate to pyruvate. That is your PEP carboxykinase. This is gluconeogenesis. So again, this will be increased. It will not be decreased. So again, option B and option C is out. So now either it is A or it is D. Okay. Now you will see that pyruvate kinase A or D में दोनों में decreased वाला ही option है. So you know that pyruvate kinase is going to be decreased in the fasting state, since pyruvate kinase is the enzyme of what cycle? This is the enzyme of glycolysis. Okay, this is the enzyme of glycolysis. So this is going to be definitely decreased. Glycolysis occurs in the fed state. Now fructose 2,6 bisphosphate, this is what will decide our answer here. Whether it is increased or it is decreased. What do you think? What happens to fructose 2,6 bisphosphate? What happens to fructose 2,6 bisphosphate? It decreases because this is basically the stimulator of glycolysis. We are decreasing glycolysis, so even this will decrease. So the correct answer here will be decreased wala. So the correct answer here is D. Is this clear with everyone? So all you need to know here is glycolysis is fed, glycogenesis is fed, glycogenolysis is fasting, gluconeogenesis is fasting. When a person is fasting, in the fasting state, what is the first compound to be used to meet our demands of the body? That is glycogen. So the first one is glycogenolysis. जो 24 आवर्स वगैरह में यूटिलाइज हो जाता है. Then comes the gluconeogenesis. Okay, first is glycogenolysis, then is gluconeogenesis. And remember that we have discussed in short 5.0 again. Out of carbohydrates, proteins and fats, which is the last one to be utilized in the fasting state as a fuel source? Which is the last one to be utilized as a fuel source in the fasting? Is it carbs? Is it fats? Is it proteins? Yes? The last to be utilized is proteins. The muscle breakdown, the protein breakdown occurs at the last. Okay? What keeps on increasing is the ketone body levels will keep on increasing. Okay, the ketone bodies, there will be ketogenesis. So ketone bodies will keep on increasing. Okay, is this clear with everyone? So that was a discussion of the first question. Going on to the next question. What is the answer to this one? What is the diagnosis here? Basically, there are symptoms of nasal congestion, discharge, sneezing when there is exposure to grass, tree pollens. So this is basically talking about allergic rhinitis and where there is nasal congestion. So if there is nasal congestion, we need a decongestant, a nasal decongestant. So if you need a nasal decongestant, will you give a vasoconstrictor or a vasodilator? Will you give a vasoconstrictor or a vasodilator? So we are going to give vasoconstrictor because remember when there is vasodilatation, the pressure increases, hydrostatic pressure and the fluid goes out. So remember that we need a vasoconstrictor. Okay, for decongestant we need a vasoconstrictor. Very good. So I hope you remember the mnemonic A, B, C, D. That is alpha receptor, beta receptor. Which alpha and which beta in the vessel? Alpha, A is the first alphabet, beta, B is the second alphabet. So alpha 1 and beta 2 alternate that. Alpha is a constrictor and beta is a dilator. So alpha 1 is a vasoconstrictor, beta 2 is a vasodilator. Is this clear with everyone? So we need vasoconstriction. So we will use alpha agonist, alpha adrenergic agonist like phenylephrine जो होता है देखना nasal decongestant में, right? So we will use your alpha adrenergic agonist. ठीक है, clear with everyone? Is this clear with everyone? Nicotinic cholinergic agonist, partial agonist like varenicline, which is nicotine-like. This is used for smoking cessation. Okay, this is used for smoking cessation. ठीक है? So yes. So that's the answer here. Basically, we will use alpha adrenergic agonist because it's a vasoconstrictor. So it would be a decongestant. Okay, that's the second question. Going to the next one. Okay, going to the next one. So it is just a one-liner question, a fact-based question which has been turned into a lengthy clinical question. So at this point, last line is always important in lengthy questions. Last line, second last line. If it is not serving the purpose, you go and read from the beginning. At this point, the ureter narrows as it passes over which of the following structures? So what point are we talking about? A non-contrast CT is done and a renal calculus is lodged in the ureter just above the sacroiliac joint. So if this is the sacrum, this is the iliac blade. So just above that, when the ureter basically is entering in the pelvis, the pelvic brim, what is making the ureter narrow there? It is the crossing with the external iliac vessels. Okay, remember it is external iliac vessels. So you have ureteric narrowing at the pelviureteric junction, right? At the vesico-ureteric junction and at the pelvic inlet, which is because of the external iliac vessels. So look at this image here. This is the ureter coming in. Okay, that's the ureter coming in. Right, what artery is this? Aorta dividing into common iliac. Outside one, this is external iliac which will form the femoral, continue as femoral. This is internal iliac. So this is basically crossing the external iliac artery. The internal iliac goes in the pelvis, supplies the perineal organs. right? The uterus, right, वो सब आएगा, rectum, uterus, that is what it will supply. So remember this image. Anatomy is best remembered with visual memory. A lot of images, if you keep seeing, you will remember anatomy. So remember that हमने image देखा था, aorta है, common iliac, external iliac. So it is crossing the external iliac artery. Okay, this is the external iliac artery where the ureter is crossing. Okay, that is the ureter is crossing. So the answer here will be external iliac vessels. Can someone tell me the left colic artery is a branch of which artery? Let me see how much of anatomy do you remember? The left colic artery is a branch of which artery? Yes? Yes, Surya, absolutely right. That's water under the bridge. Inferior rectal nahi akshat. Right, correct. Vishnupriya, Rahul, Parth, absolutely right. It is a branch of inferior mesenteric artery. Never forget that. If this is the colon, you have the ascending colon, the transverse descending sigmoid. So up to this right side, right 2/3 of the transverse colon, this is supplied by superior mesenteric artery. इसके बाद आ जाती है inferior mesenteric artery. So it is the left colic artery. The left colon is the inferior mesenteric artery. The ascending and this part of the transverse, this is the superior mesenteric artery. And that is why this inferior mesenteric artery, when it goes and supplies the rectum, logically thinking, what artery is it giving to the rectum? Is it superior rectal artery, middle rectal artery, or inferior rectal artery? What artery is it giving? So tell me about the rectal arteries. Okay, tell me about the rectal arteries. The superior rectal artery, the middle rectal artery, and the inferior rectal artery. So superior rectal artery is a branch of inferior mesenteric artery. Middle rectal artery, if you remember recent discussion as well, mousy wala, the ant and the mousy. So anterior mousy middle rectal is the anterior division of the internal iliac artery. And inferior rectal niche wala is the internal pudendal. Okay, that is internal pudendal artery. Okay? Clear with everyone? So remember, inferior gives superior, internal iliac anterior division gives middle, and internal pudendal gives the inferior rectal artery. Okay? Is this clear with everyone? So always remember this, superior mesenteric artery gives an inferior branch and inferior mesenteric artery gives a superior branch. What is that inferior and superior? So superior mesenteric artery gives an inferior branch which is inferior pancreaticoduodenal artery, and this gives inferior mesenteric artery gives the superior rectal artery. Okay, so superior gives inferior, inferior gives superior. All right. Clear with everyone? So that was right. That was your question number 3. Going to the next question, question number 4. This is important for AIIMS exam. Okay, this is important for AIIMS exam. What is this called as? It's already given. This is the receiver operating characteristic curve. Okay, the ROC curve. So quickly we will see this first aid mace snippet for the ROC. Right, so we are discussing the fast here, the first aid simplified teaching. This is from the first aid ka snippet, the ROC, receiver operating characteristic curve, which is basically the relation of true positive and false positive. So on the y-axis you have true positive and on the x-axis you have false positive. True positive means sensitivity or specificity. Do you remember the mnemonic from PSM? Again, true positive and true negative. P is for N and N is for P, right? So remember that P is for N. That means this is sensitivity. N is for P. That means the true negative is specificity. So P is for N and N is for P. So true negative is sensitivity, true negative is specificity, and true positive is sensitivity. Okay, right? If I ask you in terms of inversely related to, sensitivity is inversely related to false negative rate, right? So remember, it is directly proportional to true positive. जितना sensitivity ज़्यादा उतना ज़्यादा true positive detect होगा, उतना कम opposite of true positive false negative detect होगा. जितना specificity ज़्यादा उतना false positive कम. Okay, उतना false positive कम. Is this clear with everyone? We have discussed this again in short 5.0, these mnemonics. Okay. So when I say it is true positive, it is sensitivity. When I say it is false positive is inversely related to specificity. How do I represent inverse related to specificity? Is by writing 1 minus specificity, right? So let's say if specificity is 20%, 0.2, so false positive होगा 0.8. If specificity is 0.4, तो false positive होगा 0.6, right? So higher the specificity, lower the false positive. This is given as a relation by 1 minus. So 1 minus specificity. The first point that I want you to remember, ROC basically plots the true positive against the false positive. That is sensitivity against the 1 minus specificity. True positive versus false positive. Okay. Now there are 3 curves which are given here. Okay. So let me label this as the curve which is labeled here, curve A, curve B and curve C, which is the ideal one. What is this ROC basically used for? It's used for a diagnostic test, that how well it can differentiate the true positive and the false positive, right? So basically remember that the higher the area under the curve, the better is that diagnostic test. This is the area under curve for A, curve A. This is the area under curve for curve B. This is the area under curve for curve C. So the higher the area under curve, the better will be the test. So if they are asking which is the best test here, A is better than B is better than C. Okay, A is better than B is better than C. The ideal area under curve should be 1, but we don't get that ideal one. Okay. So remember this point and logically thinking, remember that this curve, when I plot this curve, okay, look at this curve here. So the higher the sensitivity, okay, basically the higher the sensitivity, the lower is going to be the specificity. They are generally inversely related. Look at this point here. Let's come to this question here. Okay, let's come to this question. So this is the ROC which is given here. Okay, this is the ROC which is given here. The better point is a point which is higher on the y-axis, which is basically true positive, and 1 minus specificity is false positive. So the better point is going to be the point which is high on the y-axis and which is low on the x-axis. So D and E agar dekho, right? So remember that, look at these points here. Okay, look at this point here. There is a slight difference here between D and E also. The maximum highest point here is E. So that means it is giving the maximum sensitivity. Okay, it is giving the maximum sensitivity. But at the same time, remember the false positive is also increasing. But here, why is E the best point? Why is D or C not the best point? Anyone? The correct answer here is E, where the question is asking you that a screening test is available through analysis of venous blood. The disease is irreversible and fatal if it is not discovered and treated early. So which of the following is the most appropriate cutoff point between normal and abnormal? Expect this question in your INICET exam. Very, very important. So tell me that why in this particular question D is not better than the E, or C is not better than D and E? Because when they are telling you that the disease is irreversible and fatal, so what is my primary aim here? My primary aim is to diagnose the disease. whoever has a disease should be diagnosed so that they receive early treatment. Okay. So basically, I want an early diagnosis. I want all the positive patients to be detected. So basically, I want the true positive to be high, right? I want the true positive to be high. So that means I want the sensitivity to be high. Okay, the sensitivity to be high. I do not want anybody who has a disease present is testing negative. Okay. So if the patient has a disease but the test is coming negative, is this true positive, false positive, true negative or false negative? What is that? Yes. What is that? If in a patient a disease is present but the test result is negative, is it true positive? Is it false positive? Is it true negative? Is it false negative? So always remember that when the disease state and the test result are in opposite direction, disease है लेकिन test positive नहीं है, that means this is a false result for sure. This is a false result because the two are not in sync. And whatever is the test result, basically that is what is it? This is false negative result. What is the test result? Negative. So this becomes your false negative result. I don't want anybody to have the disease and test negative because the disease is fatal. अगर मैंने miss कर दिया, so it is fatal. So basically, I want true positive to be high. I want false negative to be less, and that is what is satisfied by maximum sensitivity. So that is what is going to be the priority here. The priority here is the maximum sensitivity. Okay, I don't want anybody with the disease to be testing negative. I don't want any false negative. That means less false negative, sensitivity high, and that is why the maximum sensitivity here, this is the point E. So the answer is going to be E here. Okay, the sensitivity is the priority since this is a fatal disease. Is this clear with everyone? Right? Is this clear with everyone? So this is what is about ROC. And remember that if you have a line which is going in the midline, okay, dividing the AUC between half and half, this is where it actually has no predictive value. Okay, if it's a line in between dividing the area under curve into two, this is the no predictive value wala graph. Okay, and the ideal is this one, maximum area, but the actual which we generally get is more than 0.5 but less than 1. That is what we get in practice. Okay. Yes, is this clear with everyone? So that's how you would solve this question, a very interesting and a conceptual question. Going to the next point, again it's a long stem question, right? But then look at the last lines. Which of the following is the most likely effect of this? Expanded nucleotide repeats on the transcription of the FMR mRNA. Okay? So expanded, the expanded CGG trinucleotide is heavily methylated. That is what is the key word here. Okay, that is what is the key word here. So basically when the CGG trinucleotide, it is methylated, all you need to remember is the mnemonic here. What is the mnemonic here? Very, very important in genetics. What's the mnemonic that you need to know here? Remember that methylation, M for M, mutes the gene. That means it does not allow the gene to be active and to produce the product. Okay, it is methylation basically is muting. And what activates the gene? Very important, activates AC acetylation activates. Methylation mutes the gene. Okay, the methylation will decrease the transcription because methylation is muting the gene. Is this clear with everyone? Right. If the disease is not fatal, in the previous question many of you have this question कि अगर disease fatal नहीं है, generally वैसा question नहीं आएगा क्योंकि वो फिर बीच में चले जाता है. So, if logically thinking, if the disease is not fatal, what you want is high sensitivity and high specificity also. That means you want high true positive and you want a low false positive. So, in that case, C would be becoming a better answer there. ठीक है, C और D basically ज़्यादा better हो जाएगा, right? The true positive has to be more, the false positive has to be less. Okay. Yeah, so we were talking about the methylation muting and acetylation activating. So it is decreasing the transcription, and that is what happens in your FMR. Okay, the FMR gene, the Fragile X syndrome. So what do you have in Fragile X? Fragile X normal CGG wala is less than 55. 55 to 200 there is pre-mutation, and more than 200 repeats so there is mutation, methylation muting. So no protein coming into play. That is what happens in your Fragile X. It's a trinucleotide repeat CGG. Remember fragile के बीच में आता है G. The repeat is the CGG, not CAG or not CTG. It is CGG repeat. Remember fragile X all XL size. So XL size ears, XL size jaw, XL size testis, which is seen in post-pubertal age, macroorchidism. That is what you see in Fragile X, plus there is mental retardation. Okay, plus there is mental retardation. Is this clear with everyone? Yeah. Alteration of mRNA splicing. What is splicing basically? Splicing is removal of introns or removal of exons. What is splicing of RNA? What is the splicing of the RNA? Removal of introns or removal of exons? So when there's an mRNA formed, it has introns, it has exons, introns, exons. What happens? Very good. So remember that in mRNA, the exons are expressed. Okay, exons, EX, exons are expressed, and introns, INT are the ones which are just interfering ones. So you need to remove that. So exons are expressed, introns are interfering, so you remove them. Removal of the introns. So if there is any change in the intron and the exon, then the splicing will change, like happens in beta thalassemia. Okay, like happens in beta thalassemia. Enhancement of mRNA degradation. What prevents the mRNA from getting preventing from degradation is the addition of the poly A tail at the 3' end. 5' पे cap add होती है, यहाँ पे poly A tail add होती है 3' end पे. So if this is not happening, the poly adenylation वाला tail नहीं हो रहा है, AAA वाला tail add नहीं हो रहा है, तो mRNA जल्दी degrade हो जाएगा. ठीक है? Is this clear with everyone? Right? So remember that basically what happens in FMR, the Fragile X, is the methylation which occurs, okay, that mutes the gene, and that is why that FMR protein is absent, okay, and that is why there's Fragile X. This mutation is more than 200 repeats. Less than 55 normal, 55 to 200 is pre-mutation. So that was about the fast 5 today. What were the 5 questions? A quick revision here. What were the 5 questions we saw today? Basically is the fasting state, glycolysis decreases, glycogenesis decreases, gluconeogenesis increases, ketogenesis increases. Then you have your nasal congestion. The decongestion ke liye you give vasoconstrictor, which is alpha adrenergic agonist. Third point here, basically the uterus at the pelvic brim is crossing the external iliac vessel. Okay, that's crossing just the origin of the external iliac vessel. Fourth point, when a disease is fatal, you want all the disease to be diagnosed. That means you want high true positive, right? So sensitivity is what is the priority here that we want. Okay, so the best answer here would be E. And when there is a methylation, remember methylation mutes the gene, and that is why the transcription, the RNA will not be formed, so the protein will not be formed. if there's a lot of methylation, when there is expanded CGG trinucleotide repeat in fragile X. Okay? So that was about the fast 5. All these are important points. I hope this has been helpful. Quick session here for today. Yes? Right. So we'll meet again day after tomorrow for another fast 5 session. Okay? So that's basically going to be 17th is when we will have the next fast 5 session. Okay, Ashwin is asking how many mixed bag PYQs should I practice every day apart from solving the topic wise questions as per timetable. I get 17 or 25 correct in NEET PYQs, and what can be the frequency for NEET mock. So see, basically PYQs is something that you should never get wrong. You should have a mastery over the PYQs. 17 out of 25 I would not say is like a very good score, because if you see in terms of percentage, it is like 68%, right? 68%, which has to be definitely more than this. Okay, so work on the PYQs more. Now if you have finished reading once, rather than doing the notes, go in a retrospective manner. I would say entire day pure MCQs karo, write down the areas, the topics that you made mistakes in, and read those from the notes. Go retrospective now. You know, not even like 100, I would say 200. Jitne MCQs kar pao, sirf MCQs karte jao. That will increase your accuracy, that will increase your speed as well. Okay? Okay. So yeah. So I'll update you on the next in-app live session and on the Fast 5 in the Telegram group, and even as notification in the Medsynapse app. So all of you, please stay connected there. And till then, goodbye, take care, and keep studying, keep revising, keep Medsynapsing, and keep winning. Thank you so much.